So today we have the privilege of having Marcello Na, and specifically came in person, so thank you. He's one of our former sonographers who have worked with us before, I think trained with us at some point. And congratulations to him. He won the Distinguished Sonographer Award with the Canadian Society ECHO in 2024. So it's a very unique award, which was actually recently put together by the Canadian Society ECHO. We have known Marcello for many, many years, since he was very young, and we have seen his career grow in many different directions. So one of the reasons why I invited him back is he's probably one of the ones who has more than one directions. So it'll be worth actually sharing with many of our colleagues, and because many of our listeners as well as participants are sonographers, about 65% of them when we surveyed, and to see many different possible career paths when you enter into this field, and what are the other future possibilities, and also helpful for career development. And in many ways, I've spent a lot of time in the last few years looking in healthcare professional burnout. So if you keep doing the same thing over and over again, it's very likely that you'll burn out within 7 to 10 years. This is actually what we see in many of our physician colleagues as well as nursing colleagues. So having a variety or spice of life is important. So there's no better person that I've seen in my career than Marcello to actually share with us some of the things he has done as an inspiration to all of us. So thank you.
Yeah, thank you so much, Dr. Chimin, for that introduction, and thank you so much, St. Michael Hospital, for inviting me to speak in a topic navigating career in sonography and how you can also grow in this career, burgeoning career, as well as going into the leadership role, as well as creating the global impact that you may have in your passion. So again, my name is Marcello. I'm very excited and a little bit nervous to be back. So this presentation is very personal journey that I've set out in terms of a roadmap, what I've done and what I've seen and what I've experienced. So, okay, so disclosure is I am currently working as a director at Cardiac Care North York, and also co-founder and CEO of EMHI. It's a charity organization that I've co-founded with a few other doctors, and Carlos Fernandez. Yeah, he's a research manager at St. Mike's. So there are 3 objectives that I want to bring it to you today. One is exploring the career growth in sonography and how you can navigate that through. Number 2 is overcoming the challenges and seizing the opportunities that is coming to your way or that you may be seeing in a prospect. And the 3 is hopefully you'll be able to make the bigger impact with those opportunities that's coming to you. Now, sorry, it's playing. It's a quick video. Sorry about that. Video's now playing. Interesting. Okay, well, so I want you to keep this, think about this quote. So when you're scanning, you want to do better, but is that the only way, or is that it? So once you start to having that thoughts in your mind, what are the other opportunities or possibly different path that you may be able to take while knowing what you know already? So once you start to open that mind of a different possibilities and different ideas and new ideas that come to you, you will never be the same. You will never be the person that you were yesterday. You will start to looking into different opportunities. You'll be talking to different people who know a lot about, like Dr. Chow knows a lot about computer science and programming. So I've asked him a lot about those kind of areas as well in the informatics. So that has been one of my paths asking different mentors and experts who know more about those areas. And so that you come to the certain crossroad that you want to do more, but what, or where to start, or how to start. So these questions may come in your thoughts while you're scanning or seeing patients. How can I do more than just the scanning? What kind of leadership roles are available for me out there? And also, is there any way to combine those skills that you already know or the knowledge that you're retained into business is something that you are interested in, or teaching that you might be interested in, or technology sector that you want to get involved? There are a bunch of different ways that you can tackle in this way. And I've dabbled into all three areas at my career in a cardiac sonography. So it doesn't have to be within these walls of the hospital. You can also go out into the community or different parts of the career sector that you can explore your expert knowledge and meeting people and understanding what is out there. So for me, where I started was that I started with as a student, as a Mohawk student, I started doing a Facebook group called Sonographers Corner. That's where I started doing it. It was kind of my personal thing. I was seeing clots, seeing pathology, aortic stenosis, and then I just put it into the Facebook group, and I just searched through what is the anatomy and pathophysiology, and then how certain doctors come to a conclusion of this is a severe or moderate, mild MR or AS or whatever. So I wrote those kind of blogs. And then after a few months, it started to grow. Then that's when I had an opportunity to meet this person who's recruiting for speakers at Sonography Canada. So I was invited to speak at Moncton in Nova Scotia about strain imaging. So at that time, I think it was about 10 years ago, it was kind of brand new area of the strain imaging. And I had to do a lot of research, asking a lot of questions to different doctors about so that I can convey the message to the sonographers, why this is an interesting technique and why is it going to grow. Obviously, at the time, a lot of people didn't understand. And for me, probably my expertise wasn't that great, so unable to communicate that properly. So I learned that I need to communicate to the right audience with the right language and right words to use. So after that, I thought, you know what, maybe my speaking gig and all this thing's over. But I still continue with the Sonographers Corner. And I connected with all the professors in Mohawk College about perhaps having those RDCS students to join the Sonographers Corner in the Facebook group so that they also have a better understanding, easier understanding of the aortic stenosis and pathophysiology of all those pathologies that they are learning. So then after that, in about 2 years, I was recruited as an educator at Mohawk College. And I worked there for 6 years. And within that 6 years, every year and a half, I was moving to a different course. So I started anatomy and physiology, and then I moved on to pathology, and I moved on to physics, and then started teaching more and more. And while I was there, I was taking on the projects. Like, for example, at the time, they were still filling in bubbles for the test. But when I finished DCS program, they were doing a computerized testing. So I saw that there's a gap. And I hear from other people, my classmates and colleagues, that having to do the test at school on paper, and now suddenly you have to get adapted to it, to using the computer to within the time. So then I thought perhaps I can help students from the get-go getting used to the computer system. So at the time they were using the LMS, the learning management system. So then I said, why can't we use the computerized system that we already have and create it into our computerized testing? So I didn't ask permission. I started just doing it within my course. Obviously, that cut down my time of bringing all those papers and marking at home. So rather, it was instantaneous result coming back out as soon as the students finished their test, and they really liked that that efficiency and how effectively they were able to get feedback right away. So I was taking more and more on the projects in terms of technology. So, and then almost at the end of my Mohawk college career, pandemic happened. And we've been there. Certainly you're not scanning anymore, or you're scanning so much less. And at the time I was working at Women's College and Hospital and St. Mike's, half and half. And what I was doing at Women's College was actually, I was recruited as an e-learning specialist for the critical care. Because at the time, Women's College was using the EPIC system as an EMR. So they needed somebody who can navigate it through so the nurses and doctors can able to provide the quality patient care within the COVID center. So that really helped me into getting into the technology side of the healthcare. And then, so the timeline might be a little bit messy here, but after the Women's College Hospital career was coming to an end, I found an opportunity at Norfolk General Hospital as a team lead. So I got hired as a team lead and then started to implement programs. I learned a lot at St. Mike's. So you guys should be really fortunate who are here. They had a quality control, quality assurance program. They had a Mohawk College, the clinical placement here that you are able to mentor and teach. And Kathy was one of my very, very good teacher who was very persistent and teaching me all the right way to do things. And yeah, so I was able to implement those programs that Norfolk General Hospital didn't have. So I was able to put it into a quality assurance program, and I was also able to do PAC system implementation that was coming from the old one to the new one. So I was helping to navigate that doctors, because doctors are, they're very good at patient care, but sometimes they're not very good at technology side. So then, so what their complaint was that they were able to see their echo images in only one room. And when they go to ER, when they go to ICU, when they go to different wards, they can't access those images. They actually have to come up all the way to the 6th floor to see the images and have to go back down for the patient care. There was quite an inefficiency. So I was able to put it in those software and the key link into every computer that they will be able to access, that I help them remove or reduce that inefficiencies in there. They weren't doing a lot of contrast. I was doing a lot of contrast and learning a lot at St. Mike's. Emily and Lindsay were helping me a lot with the IVs. And so I said, this is just simple. As long as you can just do it and there's initiative to doing it, all it takes is a practice. So I was able to teach a few of the sonographers who were resistant to it, introducing them and having to make them feel more comfortable. Stress echo wasn't that abundant in terms of Norfolk General Hospital, so I was able to do more of that. So there was a lot of improvement within the Norfolk General Hospital in terms of a program size. And then from there, as you get to know more doctors and you talk to many of the cardiologists, Dr. Chow has a lot of networks and a lot of, he has many of his fingers in different pies. And then, he was able to drop my name to different people in the consulting areas. So VenturePoint is hardware and software company that tried to mimic the cardiac MRI in ultrasound setting. So I was able to, coming in to their product design and user experience. So I was able to give a lot of consulting in that technology and from the sonographer's side of the usability testing. Augmented reporting, one of the cardiologists at Norfolk General Hospital actually able to refer me to this company in helping to create those reporting software and having that back end to be more useful. For example, just simple as clicking certain findings like mild or moderate or severe aortic stenosis, some kind of that. It was quite easy, just a very tedious work from the back end, but it was something that I could take and learn what is actually happening in the back end side. And also, Century Health was another company that I helped acquire and kind of making their workflow a little bit better and finding the right vendor for them to get implemented, because this company was acquiring a lot of cardiology clinics up in the rural area in the west side, in the Kitchener, Waterloo areas. So, I was able to come in and audit those workflow labs and, review their works and see if there was up to date. So all that was very interesting, and I wanted to learn more about it. So then I was looking into going back to school. So I applied myself in the University of Toronto. They had a Master of Health Informatics program. So with all these knowledge and my passion to do something more meaningful, I went to this program, Masters of Health Informatics, EMHI. And what I learned, not only the Canadian healthcare, but also I was able to learn the data analytics, statistics behind the data as to how do you make that workable in the front end, and also product design as well. And not only within the Canadian healthcare system, you were able to expand your knowledge in a more global scale, where you're finding certain needs and closing the gaps in between the clinical side of the healthcare as well as the technology side of it. Before I apply myself in the master's program, 2018, that's when I went to Malawi. I met Dr. David McCarty. He's teaching Malawian doctors who are interested in learning cardiac ultrasound. It was just a very serendipitous moment when I was speaking at Mohawk College at a graduate conference. Dr. McCarty was actually speaking right before me, and I was quite inspired by what he was doing at the time. And he was doing that all by himself. He'd be traveling 4 or 5 times a year to Malawi, fly out there, and then he will spend 2, 3, 4 weeks at a time teaching the doctors how to perform the ultrasound, how to diagnose it, how to treat these patients. And I spent a good month. It was quite inspiring, but before I left, I really wanted to be helpful to Dr. McCarty. So what I did was I called this company, Clarius. I just call the company saying, hey, I'm going to this country Malawi that doesn't have any ultrasound or cardiology program at all within this country. I wanted to bring something more meaningful. I think your company is doing a great work. I think it will be a very innovative product for me to bring. I think it would be great marketing for you guys as well. Do you think you guys can send me a product? They actually, I was working at one of the rooms, and there's a giant box came in under my name. They brought 2 machines for me to bring to Malawi for the mission. So I was very grateful, and I was able to show all these capabilities and innovation that's coming in the way, so that I was able to show around while we were traveling in Malawi for a month. So I really wanted to, after this month of experience, an inspiring experience, I wanted to help Dr. McCarty to do more, because while we were traveling, we were spending a lot of time together talking about what he has done, what he wants to do, and where he wants to be. but he was by himself. He'd be paying, he'd be sponsoring sonographers to come to Malawi, but there was only one-time visit. So then from Canadian side, how can we provide more support for Dr. McCarty to do more? So understanding that I had some of these experiences in the education side and learning, training students, and also working at a reputable places like St. Michael's Hospital, how can I do more? And bridging that gap in the education and service side, because you go there for a couple weeks or 4 weeks at a time, but when you come back, everything's the same in Malawi because nothing has moved. So then Dr. McCarty will be going back to the drawing board and do it again from the ground up. So I wanted to do it from here so that it's continuous. So during the pandemic time, we actually created this organization called EMHI. So it started as a nonprofit, and during the COVID time, nobody was able to travel, obviously. So what we did was maybe the lowest hanging fruit might be creating an online course for the students or the doctors in Malawi to continuously learn and not stopping. So that technology side, and then trying to bring that cost down, we had to start bootstrapping and trying to find an efficient way for them to learn at a very low cost or for free. And obviously, nonprofit sector it's not a physical product that you're selling like Apple or phones. So storytelling was crucial, I learned, right while running this organization as a business. So you need to have a good business model. So the master's program really helped me to hone into, narrow it down to what is most effective way to run this nonprofit organization at a very low budget. So then you have to know how to condense your mission and vision so that you can convey that story to somebody who doesn't know anything about Malawi or ultrasound, and have them to be inspired and wanting to provide support, even if that's something that's valuable as their time in teaching or their money and in donations. So fundraising was also another part that I learned to do. It's quite hard because it's not a physical product you're selling, it's more the story and the mission that you're selling, the vision you're selling to the donors, okay? And the marketing was also very difficult too, because how do you promote your organization without any physical product that's being shown, right? And also, while I was running this organization, obviously the finance is a big thing, just simple as learning how to do bookkeeping to doing taxes and all that was quite challenging at the very beginning. And it's all coalesced into running a full business and organization while you're doing something, trying to do something meaningful at the same time. So that really went on for about 4 years. And just last year, Canadian Society of Echocardiography, they asked us to partner with them to bring what's called travel bursary program, so that they select 6 candidates who are eligible to go to Malawi, and they would fund these volunteers to go for 2 weeks at a full cost, expenses paid. So that was a huge milestone for us, because that was one of our missions to bring Canadian sonographers and cardiologists who are training into Malawi and have them experience this new area of cardiac sonography. So later on, at a Cardiac Care North York, I was recruited as a director to oversee the finance, oversee the operation, HR, marketing, recruiting, technology investment. There's a lot of things that you oversee just running a business alone. and while you're trying to make sure that there's a clinical efficiency for doctors and sonographers and all the technicians as well as the admins. So everything that I've learned so far, from Mohawk days to consulting to running an EMHI, everything now is putting into a practice and creating something that's more operational and create a more meaningful strategy for a business to be proliferating and thriving. So you may have these different types of thoughts in your head while you're scanning or when you're home or you're reading a book or listening to a podcast. Okay, if I don't want to be in the business side, I don't want to be in the technology side because it's too complicated. AI is coming. You like it or not, AI is coming. And Dr. Chow probably know this very well, and Dr. Ong, who was also involved in the research for the measuring the LVOT and aortic root for the very efficient way of doing the TAVI. So I was actually talking to Dr. Ong about how do I get involved in the AI research. Obviously, it's only happening in a bigger institution in academic settings. So it is a bit challenging, but you can definitely volunteer to do anything from something tedious as documentation, but you're learning from the ground up. You can volunteer yourself if there's an opportunity arises. Perhaps you want to be specializing in advanced imaging, like strain imaging, 3D imaging, TEEs. That's also burgeoning, so you may want to be really specializing to this certain area so that you're becoming the expert in that specific area. So that's on the clinical side. You like students teaching and how you get meaning out of teaching and mentoring, just like Mohawk College, and while you're in the St. Mike Hospital or any other clinical sites that you oversee patients, patient care with the students. You want to teach them at in a more deeper meaning with more of the training so that they can become like you, more like you. So you're training and mentoring the next generation to become more impactful. So, but now you're coming into, okay, I want to do some business on this side, or you want to get into the technology, then obviously I think having that higher education definitely helps. Even if that's going back to school for a couple of years and really get into the current state where the trend is going, I think it's very important for you to have that knowledge. Because many of my classmates at EMHI program U of T, they've either start creating their own company or they start working at consulting companies, like big companies like Deloitte or EY, because they have a healthcare technology division where they do a lot of consulting, or in the research area. So it is very vast. So you can definitely go back to school and start learning about what is out there and expand your mind with that. And then, if you want to do more of impactful stuff, you can definitely reach out to us, EMHI, to do more meaningful work in terms of educating the doctors or providing services that they don't have, and providing the outreach projects like, rheumatic heart disease programs, or scanning and teaching the programs that, so for example, EMHI created this e-course. Now there's 15 courses that are full, and it's about 40 hours each course that you get to learn. And they're Malawi's only medical school, Kamuzu University Health Sciences. They partner with EMHI. They're now looking into implementing a cardiovascular technology program for their nurses and doctors, and they want to use our online course to be their main curriculum. So, that's something meaningful as well, that you want to be a mentor and teacher within this role. You don't have to physically travel to Malawi, but you can do it from home or at your office. Yeah, so that was my journey. Thank you.
Well, thank you, Marcello, for sharing this journey with us. It's always good to see some of our junior colleagues through the career over the years and expand and beyond, and also bring some of the things we do here to other institutions and even further abroad. And so if you have a young person coming up to you who is in training or in their early career as a sonographer, what are the 3 things you would tell them that about yourself and your journey that motivates you? Because obviously you put in far beyond what most people would do than your day-to-day job.
Well, one thing is, if you're a junior and you're still learning, especially in the student side, learn about sonography as much as you can, and just provide a top quality studies, because you may not communicate with doctors directly, but your work actually speaks a lot of volume. So we all know Bean is one of the top sonographers, I think, in Ontario, if not in Canada. He has taught so many doctors, but he just knows so much about cardiac sonography, as much as fellows do, the doctors do. And often I see that doctors come to him to ask, what do you think? So I think having that in-depth knowledge is key. So try to learn as much as you can. Even if it's a pediatric that you want to go into, sure. You want to learn as many things as you can, and learn about the pathologies, so that any cases that come to you, you have an open mind to learn, but also open mind to teach others and transfer the knowledge. Second thing is, now you're learning about echo. How do you market yourself is the second thing, is because no one will just come to you, ask for your expertise, unless you're marketing yourself as, I'm expert in this. Okay, so be special. If you want to be specialized into in certain areas like 3D imagings and strains or whatnot, you can branch out from that small seed into research programs. I've seen so many other colleagues who started at just wanting to learn so much about one area, and then they applied going back to school into clinical research, and then they become that experts and helping out with clinical research in that area. Lastly is, you got to learn the technology side, because we've seen and we know a lot of people who've gone to the vendor side, like a GE and Philips, and what they know best is teaching others, and also about the technology of the machine itself. So you want to start getting familiar with that technology side and be comfortable being uncomfortable. So you have to keep learning and open mind about learning new ideas, because as AI is coming, things will move very quickly. And it's not only about quality of the studies, because now we see that computers will generate 80% of your report for you. Then all you got to do is create the quality image. But you don't want to stop there. You actually want to know how this AI is actually thinking, and how I can benefit from using these AI programs or any other technologies that is coming into your way. So those main 3 things, I think I would tell those junior sonographers who are coming into this field.
Thank you. So any questions?
Some question.
Okay.
There's a question like.
Oh, there is a question. Okay, let's see.
I guess.
Okay, so let's see what Amin asked this time. Okay, so let's see. So Amin, please go ahead. Please unmute.
Thank you for the presentation. That was excellent. Without giving up my age, I'll tell you I'm a PGY 44. And I love echo. I'm passionate. And I grew up with mentors where we would interact with the sonographer. And I can tell you there was an editorial written by Alan Perlman in the American Society of Echo Journal about 20 years ago. And he talks about echo as a team sport. So the sport between the sonographer and the reading physician is so critical. So I wanted to ask your opinion on a day-to-day basis when you're doing an echocardiogram. In what proportion of patients do you think you should have the echo images reviewed with the physician who's actually reading the echo with you before the patient leaves the facility?
Percentage? I mean, first of all, you have to be comfortable with what you are seeing, but I would say at least half of my patients that I see, either it's an interesting case that I want to bring forth to their attention, or it's a critical findings, or simply as just, I'm having difficulty, is this mild or is this moderate? And then we come to that a lot. Is this mild to moderate? Do I have to say it in the between? So when you come down to the physical number side, the ranges of mild, moderate, severe, I often, other sonographer, junior sonographer will come to me and ask me about my opinion, but also then I will refer them to say, I need you to actually go to the cardiologist and speak with them about, because one cardiologist may say one thing, and the other cardiologist will have a different understanding of their range and different categories of how they decide on certain report findings. So I would say about half, even though I'm comfortable with saying this is normal or abnormal, at least half of my patients that I see, either I even ask my junior sonographer saying, hey, what do you think? So that it's not just about me learning, but I'm helping the others learn as well. So
yeah, I think
right, yeah, it's a team sport for sure.
Yeah, I think it varies quite a bit. And I would be curious to find out at St. Michael's Hospital what's the routine that they follow, because certainly in a private clinic, people work in silos. There's very little interaction between sonographers and physicians.
Yeah. So let's comment about that. So from a physician point of view, it's been more and more challenging over the years. I'm a PGY 35, and so during my early training years in McGill, which is in Montreal, and as well as Boston, there was a way that we worked that all the sonographers would bring the tapes to us, or we would go to the machine and review the images before the patient actually goes away. So imagine we try to do that these days. It becomes very challenging in terms of the volume, but then also with the technology, we're able to archive things a lot better. We don't have to worry about like the tape disappearing. And so technology actually helps us a lot. But we do structure ourselves at St. Michael's Hospital where the physician who's reading is present and not doing other clinical work and only doing reading. So I think that's the way we structure ourselves, and we encourage our sonographers to come to us and actually ask questions. We also have the privilege of having our echo fellows who are very, very knowledgeable, and they can be our first line of defense, so as to say, with a sonographer in terms of answering their questions and making decisions together about using contrast or additional views or reviewing critical results, so on and so forth. We also encourage our trainees as well as our sonographers to review our reports, because then that's where you would learn a lot about how things are being interpreted, and your interpretation will keep getting better. And I mean, the other thing that we do a lot is these rounds where, we conduct these rounds regularly, and especially we have topics that are targeted towards various aspects, as Marcello alluded to, both technology, the disease process, as well as sonographer topics. So we're trying to bring a lot more sonographer topics over the years, and this is actually one of the efforts of doing so.
Can I make a comment on that too?
Yes.
Although I do echo, one of the things I would suggest for anybody in the team is that if they have a technically difficult study, they should consider bringing it to the doctor before they send the patient away, just for your own benefit of sort of saying, hey, this was technically difficult, so that later on you don't get an email saying, why didn't you do this or why didn't you do that? It's just a great idea to sort of say, this was technically difficult, because you will get emails about it. I know you will. So it's to your own advantage to say, this was technically difficult. Can you look at this? You show them why it's technically difficult. They sign off on it and the patient goes, where it's a lot easier to do that than sort of get an email later on sort of going, oh, you should have used contrast, or maybe you should have done this or done something else. Those are the ones I would suggest anybody brings to the talk.
There was a study done a few years ago in the US at a congenital center, and they did a study when they had a patient, which was a new patient to the lab with congenital heart disease. And they did a study where they instituted the routine where a physician reviewed the study with the sonographer before the patient was discharged. And there was approximately a 30% improvement in the completeness of the study and the diagnosis. And guess how much extra time was spent? 8 minutes.
Yep. No, that's a point well taken. I think, especially with complex congenital conditions, this is actually a routine that we would do here as well. And so, it's things have continued to evolve, and we're very fortunate to have great sonographers as well. And most of the time, they're very, very good at, most of the cases. And there are definitely certain cases in the day that will come up that is actually challenging, that we need to put all our heads together. So indeed, it is a team sport. So let's move on to the next questions about MTMA, so we can have some airtime about MTMA.
Thank you. Thanks for the question, Habib. Yes, MTMA does not have a program within it, but we do collaborate. So last October, I went to Malawi to screen these patients who are on the government list. There are about 400 patients who are waiting for either cardiac screening or surgeries. And from the US, there's a group called H4MI. They're part of the Seventh-day Adventist group. They sent about 20 people, sending almost all the things within the OR stuff, as well as the pacemaker implant. And so Dr. McCarty, who trained at Mass General, he used to do pacemaker implant. And so one of the doctor from Washington came over and helped him to do 8 pacemaker on November. And we were able to screen those patients who need those pacemaker as well. But this Seventh-day Adventist group came last April for the first time in Malawi history to do cardiac surgery on 12 people, all successful, and having to put 8 pacemakers. And they came in last November, and they're coming again in coming April. So they're doing this, this tour for 4 times, and they're trying to make the Malawi government, to fund these programs so that it's ongoing. I hope that MTMA can partner with any organization within Canada to make that same impact or even more. If it's coming from Canada, that would be more meaningful. That's one of our vision as well, trying to put some kind of a cardiac device implantation program, or even if it's as TAVI or simple, not simple, but as a cardiac pacemaker devices. Yeah.
So it's a great story to show that when the world works together, everyone benefits. And so maybe you can talk about, the opportunity for MTMA that is supported by Canadian Society ECHO. I believe there's a travel grant for sonographers as well as physician in training.
Physician training.
So you want to talk about like what it entails and the application process and the amount of support?
Yeah, so this year has closed because we decided on having these 6 people going for 2 weeks at a time, and we're trying to have 2 people going at the same time, and so they work as a team. So one person be teaching, one person be helping to do a hands-on training, and CSC has graciously putting this program out there to support $6,000 per person to travel for 2 weeks. And so what we do from the EMHI side, that we're just kind of working like a travel agency. We book your trip from the beginning to the end. So we book your flights, we do your travel insurance, and we book your hospitality, your logistics, safari tours, and tea farm tours, yeah, as well as you're visiting the local school to see the little kids or even the high school students who are hoping to become a doctor in Malawi. So one of the doctors here wearing the t-shirt, EMHI t-shirt, his name is Dr. Whitson Kaliapa. So he wanted to become a cardiologist. I think he's the youngest out of 6, and his father is a tomato farmer. He unfortunately passed away while he was farming, so from a heart attack. So he wanted to really become a cardiologist, and he's a bright person. And we've been supporting him since last February, every month, giving him the stipend to train as a cardiologist, become a cardiologist. So when you visit, you will see all these students and learners and nurses and doctors, or they call it clinical officers and medical officers. So you get to interact with them, you get to teach the echo hands-on training, and you get to help them do a preliminary report, and you also do diagnosing and doing a treatment program together as well. Yeah.
So a word of encouragement to consider applying for next round.
Next round, yes.
It's a nice working holiday. And, it's only available for sonographers and physician in training.
Yeah.
All the support. So physicians who are not in that category will go on our own. But still a worthwhile experience.
Yeah, so now because we have become a charity organization, so what we encourage the doctors who actually wants to go there for 2 weeks as their working vacation would be to them donate to us, and then we write the charitable receipts, and then we book everything from that fund. Yeah.
Okay, legitimate tax write-off. So
there you go.
Good, and also serving the world as well.
Mm-hmm.
So with that in mind, I think we're coming up to 9 o'clock. So very unique lecture. So thank you so much, Marcello, for sharing with us. Hopefully, we can continue to work together. We certainly have a lot of education material that can be shared worldwide. So